Okay, scan the room. I do like the popper thing. Maybe I'm gonna get one. I'm gonna get a cool one, like a Spider-Man. Shoes?
Shoes.
Yes, we are.
So today we're doing the dressing change skill. So the first thing I want to do is verify my 12 safety practices. So I'm going to verify the order for my client. I'm going to gather all the supplies that I need. I'm going to consult the manufacturers in relations to our equipment. I'm going to verify the facility's policy. The next thing I'm going to do is knock on my patient's door and identify using 2 identifiers. I'm going to wash my hands before and after the procedure. So after I identify my patient, I'm going to assess their overall condition. I'm going to provide privacy and explain the procedure, and then I'm going to raise the bed to working level. I would don PPE as necessary, and I would raise the side rails according to care plan. And then after the procedure, we're going to lower the bed, make sure that they have a call light, and again, with the side rails according to their care plan. And then I would report any abnormal findings to the charge nurse and wash my hands before leaving the room. So the first thing that we're going to do is take off the old dressing, and we're going to assess the wound. So after I wash my hands, put on a pair of gloves. We're going to expose the dressing. Try not to expose too much of Mr. Jones. We want to make sure that he's had his medication 30 minutes prior, because this can be kind of a painful procedure. Mr. Jones, how are you feeling? Can you rate your pain on a scale of 0 to 10? So he says it's at a 1, so we're okay to go ahead and get started. So we're going to remove the tape from the skin. Make sure that we're not causing Mr. Jones any pain. Whenever we remove the dressing, we're going to want to remove it towards the head of the patient so that they don't see the wound. Don't want to cause any distress. We're going to dispose of this into biohazards. So the next thing that we're going to do is assess the wound. We're going to check for the length, the width, the depth of the wound. We're going to check for any drainage and the type of drainage. And we want to assess any odor and possibly any infection. So we're going to measure the length first, starting at the top of the wound. 13.5 millimeters. And then the width at the widest part of the wound, it's about 2.5. Then we're going to assess the depth with our Q-tip. Into the deepest part of the wound, put our finger at skin level. Then we notice 2.5 centimeters. So we're going to note for any tunneling or undermining. And I notice that there's no drainage and it doesn't look to be swollen. There's no tunneling or undermining. Throw that away. So go ahead and take our gloves off and wash our hands. The next thing that we're going to do is get our sterile field ready so that we can apply a new sterile dressing for our patient. Over this away from me. Want to make sure that we're keeping a 1-inch barrier to keep the field sterile. And go ahead and take our gauze and check the expiration date. Notice that they're still in good use in the least invasive manner. Remember the top, throw that away. Check our saline. It's not expired. Place label in our hand, and again in the least invasive manner. Apply some saline to some of our dressing. So the next thing I'm going to do is go ahead and put on my sterile gloves. So we're going to go ahead and clean the wound. So I'm just gonna take the dressing and clean it long ways. And with each stroke, I'm gonna grab a new gauze. You're not in any pain, are you, Mr. Jones? You're not? Okay. Good. Okay, so the wound is all clean. So the next thing that we want to do is pack the wound. So we're going to use our dressing that has the saline on it. We're going to fluff it up. We don't want to cut the dressings because we don't want to leave any fibers in the wound. So we're just going to use Q-tips to pack it. You doing okay, Mr. Jones? Good. Okay, so our wound is packed. Throw that away. Make sure your hands aren't going below your waist. And then we're gonna take our gauze, place them over the wound. And then we're going to take our ABZ pad, place it over the top, and just that. So we already have our tape measured out. So I want to make sure that I put my initials and the time and date on our last piece of tape. So I got my time, date, and initials on this last piece. And then I would don my gloves and I would document and report any abnormal findings to the charge nurse.